Now we want to go to an update on someone that you met right here at the height of the pandemic. You might remember Howard Sandau, a nurse inside an intensive care unit in New York.
As far as the nursing staff, I mean, this is an incredibly, incredibly sad situation for all of us. We're fighting day and night, trying to save people's lives.
It's very, very, very sad and very hard on you as a person, emotionally and physically.
That was Howard talking about the COVID crisis in New York City and his experience treating some of the sickest patients. Today, Howard is still working in the ICU and earlier this morning became one of the frontline workers to get the coronavirus vaccine. And Howard Sandau is back with us now. As we said, he's an ICU nurse and also a special representative for the Federation of Nurses. Howard, it is great to have you back here. Let's start with the optimistic news here. You received your first Pfizer vaccine shot. How are you feeling? What was the moment like for you? And did it cause you to reflect on the challenges you've grappled with this year?
So I woke up very, very early this morning with great joy in my heart that I was going to be able to get this vaccine. I got to the hospital and I took the vaccine about 2 hours ago. I've had no side effects, no pain in my arm. It was a very simple process. And I just feel an immense sense of relief that this day is finally here after what myself and my colleagues have gone through over the last 9 months. The struggles, the pain, the sadness, and now the overwhelming joy that I feel personally that I've been able to receive this vaccine. And I want to encourage everybody to get this vaccine. We all have to get it. 70% of us have to get this vaccine in order to get herd immunity. And we need to get there so we can get back to our lives and enjoy the summer that's coming. And that's what I'm looking forward to.
I think we all are. Howard, have you heard resistance from your fellow ICU nurses to receiving the vaccine? I mean, what have you heard about your fellow medical professionals being concerned about it?
So I've heard some concerns. I've heard some of my colleagues say they're not going to get the vaccine. They don't want to get the vaccine. And of course, it's not mandated at the moment. But again, we need to get 70% of everyone to get this vaccine. So, they do have concerns. I think a lot of people are sort of waiting to see what happens with the people who got the vaccine. And look, I'm here today to say that it was really no big deal. And I'm very, very happy to have done it. And I just encourage all of my coworkers to get the vaccine. Everybody is kind of nervous because, it's a new vaccine and it's came out fairly quickly. But that's modern medicine and science, and that's what we have to rely on.
No, it's absolutely an important point. And also, Howard, I wanted to ask how things are right now in your hospital to this point about trying to end this. It was so bad in the spring. What's it like right now?
So after the spring, the summer was slowed down quite a bit. Of course, that's due to the public health process that the state of New York put in place with the masks, with people social distancing and doing all the right things. And that's why we were able to keep our numbers down over the summer. So now we're starting to see an uptick in the volume of patients coming into the hospital, into our emergency room. Our ICU is filling back up with COVID patients. And there's no question that we're feeling that things are changing right now. And I can only describe it the way we're all feeling is like a tidal wave. You feel like it's going to come and collapse over the top of you at any minute. And so we're nervous, we're scared, we're concerned about our staffing, obviously, because, in the spring we were able to get a workforce from all over the country to come help. And I'm afraid this time it's not going to happen. And everybody has a high anxiety about that. And also suffering from post PTSD from the spring. So, we're all really nervous and really scared that, what's going to happen over the next 2 months. but, with some hope for what's really going to happen in the summer when we're all vaccinated.
Let's focus in on that hope, and thank you for that message to everyone. Howard Sandau, thank you so much for being here today and for all the work you and your colleagues are doing.